Hello everyone, welcome to Talking Health with DrLaz, your favorite health program on television. Yes, today we are taking it from outside the studio because we have a very beautiful story to tell. Recently, the Talk Health Niger team participated in what is called Solutions Journalism Training. And the essence of that is to enable us tell stories from the point of solving problems, not just focusing on problems. Of course, most of our stories have been focusing more on the solutions and not just the problems. But this training kind of made us to know other ways, better ways of telling some of these stories, because as you know, so many negative stories out there, so we need to bring out many positive things that are happening as well. So we'll be running at least one of such kind of story, that focuses on what individuals are doing, what groups are doing, what government is doing to improve situation, bring solutions to certain problems affecting the development of our country, especially in the health sector. So today we'll be looking at a proven method of preventing cervical cancer. Now, cervical cancer is a cancer that affects many women around the world, including Nigerian women. And it might interest you to know that it's the number 2 cause of cancer-related death in Nigeria, killing over 14,000 women every year. COVID killed about 2,000 plus in a whole year. Cervical cancer killed over 14,000 every year and causes other devastating losses. But the good news there is it's preventable. We know the cause. Unlike so many other cancers, the cause is well known. About 70% of it is caused by Human Papilloma Virus. Yes, it's a type of virus that is transmitted via sexual intercourse, which makes it a sexually transmitted infection. And human papilloma virus, is implicated in close to 70% of women with cervical cancer in Nigeria, according to research. But there is a vaccine against human papilloma virus, and this vaccine is called HPV vaccine, which is essentially human papilloma virus vaccine. So today we're going to be looking at the efforts to make this vaccine accessible, to young girls, because it's for young girls who have not even started sexual intercourse. So they are in schools, to make as many of them as possible to get it. So the government of Nigeria, through the national strategy on immunization and primary healthcare system strengthening 2018 to 2028, a 10-year plan captured this. The National Cancer Control Strategic Plan 2018 to 2022 also captured this, and so many other health policy documents. So to make this reach so many persons, it means that girls between the ages of 9 and 14 years must have these vaccines, and it has to be free. So we are going to be talking with, in the first segment, a young girl who during her youth service was able to mobilize resources, went into a school in Federal Capital Territory and got some girls vaccinated against human papilloma virus. And in the second segment, we'll talk to members of some national committees, civil society organizations, and also bring to you certain efforts the government is making in this regard. Do stay with us. I'll be introducing my guests after this break. Welcome back to Talking Health with DrLaz, your favorite health program on television. Yes, we are talking about human papilloma virus vaccination to prevent cervical cancer in Nigeria. And in this first segment, I'll be speaking with Oluchukwu.
Okay.
Yes, Oluchukwu Okeke, who is a girl child development advocate. You're welcome to the program.
Thank you, sir.
And I have 2 very beautiful students. By my right, we have Aisha Shehu, who is a girl child, of course, very obvious. And we also have Chiamaka Chukemeka. You are both welcome to the program. Okay, Ms. Oluchi Okeke, you mobilize resources to do HPV vaccination for some girls. So tell us about it and your motivation behind that.
Okay, cervical cancer has been a great burden in my heart. I've been looking for a way because I've heard so much about cervical cancer. I've lost dear ones even before I was born to cervical cancer. And yet, cervical cancer is responsible for thousands of deaths among Nigerian women, even in the whole world. But at least other countries, the high-income countries, they are doing something to curb the incidency of cervical cancer. But my country, women keep dying. My kind keeps dying of cervical cancer, and nothing is done about it. It has been a great burden in my heart. So when I went for my National Youth Service program here in Abuja, NYC gave us the platform, an opportunity to write any of the SDG goals, any of the SDG goals that you have passion for. So I picked SDG goal 3, and I wrote about cervical cancer, and I got sponsorship from Sigma Pension, and that was during the peak of the COVID, but I still, because of the passion I had for cervical cancer and curbing the incidency of cervical cancer, I was advised to shift into COVID-related, but I really wanted to make an impact, to do something about cervical cancer, contribute my own quota in fighting cervical cancer.
So how many girls were you able to vaccinate?
Okay, because of the fund, I was able to vaccinate 11 girls.
11 girls?
Yeah, it's from POE community, here in Abuja, from POE community.
So how much?
Per dose is 13,000 naira, and they took 2 doses.
Each of the girls took 2 doses?
Yes,
so
yes.
That's around 26,000?
Yes, per girl. Yes, for the 11 girls from POE community.
So coming to you, Aisha Shehu, what do you know about cervical cancer?
Cervical cancer is a malignant tumor that grows in the cervix of a woman.
Chiamaka, what do you have to add to what Aisha said about cervical cancer?
Cervical cancer is peculiar in all women. It is a type of cancer that starts in the cervix of a woman. It is the leading cause of death among women in Nigeria.
Yes, it's actually one of the leading causes. Breast cancer is the leading cause of cause of death among Nigerian women, and cervical cancer is actually second. But yes, you're right that many women are very much affected, and that should stop. Okay, coming back to you, Aisha, how do you feel? How did you feel when you received the HPV vaccine? When you got those injections, how does that make you feel?
I feel great. I am happy because I feel privileged that I have lower chances of contacting HPV virus that causes cervical cancer.
Oh, great. It's really a privilege because not many girls like you have had this privilege in Nigeria. So, how old are you?
I'm 12 years old.
12. Great. And you're from which state?
Kogi State.
Kogi State. So if you meet Governor Yahaya Bello today, what message are you going to give him about Human Papilloma Virus vaccination?
I'll tell him, sir, please, we need you to ensure that the HPV vaccine is given to all girl child in Nigeria between the age of 9 to 15.
Okay, so I'll now come back to you, Chiamaka. So same question I asked Aisha. What was your feeling having been vaccinated against cervical cancer or human papilloma virus?
I feel great. I feel happy because as a woman, my future is guaranteed and I'm free from cervical cancer.
You are 13 years old, right?
Yes.
Which state are you from?
Abia State.
All right, so if you meet Governor Kezie Ikpeazu today, what message are you going to give him concerning human papilloma virus vaccination for girls like you in Abia State?
I will tell him to ensure that every young girl like me gets the HPV vaccine for free in Abia State.
So, Luchku, you did a great job. It's been nice speaking to your girl. So, in year 2030, that's like about 9 years' time, where do you want to see Nigeria in relation to cervical cancer prevention and HPV vaccination?
Okay, a Nigeria free of cervical cancer, a Nigeria where the national HPV vaccine is included in the national immunization routine, a Nigeria where all the health centers in the states, the towns, the communities, a girl can walk into the health center and easily get the free HPV vaccine.
The federal government is actually planning for those age of 9 to 14.
Okay, it's
But,
okay.
yes, but it's not only exclusive to them. Even those 15 years old, you know, can as well have it.
Catching them young before they are sexually active. So, advocating for free HPV vaccines, that they can easily walk in there and get their vaccine.
And get it. Even those who cannot walk in, it should be taken to them just as they do for polio. I really thank you for being on the program.
Thank you, sir, for having me and having my girls too.
And I also thank Aisha
I really appreciate it.
and Chiamaka. You know, so thanks for making our time to join us on Talking Health with Dr. Laz. I hope you love your experience.
You did.
Great, you did.
Yes.
Thank you. Welcome back to Talking Health with Dr. Laz, your favorite health program on television. Yes, I'm here in the office of Mrs. Chiko Ford, the founder and chief executive officer of Vaccine Network for Disease Control. And she is also a member of the Social Mobilization, Demand Generation and Communication Subcommittee of the Human Papilloma Virus Introduction Planning Committee.
Yes.
I think is the National Primary Healthcare Development Agency.
Yes, of course.
All right, great. So good to be with you.
Same here.
Yes, I made an effort to get the executive director of the National Primary Healthcare Development Agency to talk to him about this, but it didn't work out. As you know, COVID-19 has kind of taken most of their time.
Exactly, especially now that we have the vaccines that are here.
Vaccines,
The Moderna vaccine is here, so I'm sure he's focusing on how to make sure that it gets to every state.
Most likely. So, it's good I was able to get a member of the committee. Very quick one. Can you kind of summarize the effort that's been made so far to get this into the routine immunization program?
Okay, that was the plan. The plan was to make sure that the HPV vaccine gets into the routine immunization program. You know, and it was working well. We're part of the Social Mobilization Committee and Communication, and everything was going well with Gavi in Chai and different organizations. And guess what happened? COVID happened. So immediately COVID happened, all hands were on deck to sort out the COVID issue. So right now it's like a bit on the back burner. But it's something that has gone through a process and is sitting there. So once the time comes up, because now they have an integrated approach to primary health care, so I'm sure it's going to come in again. You know?
Okay, it should, because COVID, yes, a very important disease to control.
Yes.
But cervical cancer
also
kills over 14,000 women every year.
Yes,
you know, so
yes. My mother died from cervical cancer.
Oh, sorry about that.
Yes, and that was 1995. So I'm really keen on it, and I also took the vaccine a long time ago myself. Wow. But then again, you have to pay through your nose to pay. I think I paid 18,000 then for the vaccine.
Wow.
And then for 3 doses. But now here it's about 10,000 per dose.
In fact, the young girl who mobilized resources to vaccinate some girls that were interviewed in the first segment, actually vaccinated 11 girls, 13,000 per dose. That's 26,000 per person. So, but essentially what the efforts of the government is to make it free, right?
Yeah, to make it free. Because once it gets into the routine immunization program, it means that once you are between the ages of 9 and 14 and you are a girl, you can access the vaccine. And that's really cool.
The same way they get polio.
The same way that they get polio,
for pneumonia, for
exactly,
yellow fever,
pentavalent, all the other vaccines, part of the process. But you have to be within the age range that they are looking at. So between 9 and 14.
14 years.
No, very laudable, very laudable.
Some findings I made suggest that MPACD was actually planning for it to take off fourth quarter. That's from October this year.
Yes. Yes.
Let's pray that works out.
I believe it will work out because it's also at the back of our minds. We're looking at the foundation of our country, which are these children. We don't want them to have the disease because once you have the disease, it becomes a case of repairing something that is already damaged. And there's a solution. The solution is prevention. And there's, especially the aggressive one, which is the one of the 16 and the 18, and you are the healthcare people type 16 and 18, and it covers it.
Thank you very much, Mrs. Ofo, for always making our time to interact with us.
Yes, it's an honor to work with you, because you always have the right questions to ask to shake us, and they make us do our work. So now we have to also push and ask the questions like, what is happening to the HPV vaccine? Why is it not coming up? What do you want us to do? How do you want us to do it? So once we start to ask these questions, something will be done.
Okay, so that's Mrs. Chikofo has been speaking with. I have one more person that I'll speak to, before we end this program, and that's civil society community. There's a coalition, and just let's talk to him. Yes, like I mentioned, I'm coming to the CSO Coalition lead, and I'm already here with the co-chair of CSO Coalition Against Cervical Cancer, Mr. Ronsi Chidebe, who is also the Executive Director of Project Pink Blue. Welcome to the program once again, Ronsi.
Thank you very much.
This is perhaps your second time on Talking Health with me.
Yeah.
All right, so we're looking at the solution to cervical cancer. A key component of it is Human Papilloma Virus vaccination, which I know your coalition, I think, how many civil societies are in that coalition?
At the moment, we have about 9 civil societies.
9 civil societies. Okay, so so far, what efforts have this coalition made? What are the tangible outcomes or progress you've made? After that, we could talk a bit about the barriers and your recommendations on how those barriers could get out of the way.
Thank you very much. I really appreciate. So the CSO's Coalition Against Cervical Cancer is actually a platform that is set up to move into advocacy, national advocacy. We are not engaged in any form of implementation.
Okay.
One major thing that I can say we have done, because we have wife of governors, the wife of Governor of Kebbi State, Dr. Zainab Shinkafi Babudu, that of Niger, Amina Abubakar of Niger.
And they are co-chairs
as well. And they are co-chairs as well. And we also have other co-chairs across the country. The goal is not just to advocate for Nigeria, for the federal government to actually implement the HPV vaccine, but to ensure that this is spread across the country.
Okay.
In different states. So the goal is that we should know everything. We're only asking the federal. Let's also speak to this state government. State government.
Have you started speaking at the state level?
Yes, we have really started, and that is one major outcome or deliverable that we are really pushing for.
So what are the specific asks for the state governors?
The specific ask is that the federal government in the budget, the National Cancer Control plan, budgeted about 60 billion for prevention of cancer.
Okay.
So what we are saying is that each of the state governments should pick that part. Just as a start, pick that part. Imagine if each state government gives just 1 billion for cervical cancer prevention. We will achieve a lot.
Right. So far, do you think there's any state that has taken steps or actions in line with what the National Cancer Control plan provides for that, could be emulated by other states. Is there anyone
Yes.
so far? Okay.
Yes. To the best of my knowledge, Kebbi State government have started something. Kebbi State government actually have now a Kebbi State cancer control plan, and they have made some progress in terms of financial access.
I think that was launched like 2 years ago.
In 2019.
Yeah, 2019.
Yes. And I think Niger is already preparing. Ondo is also preparing. Ondo has made some progress, and Niger has made some progress.
And these are states where the wives of governors are, leading advocacy in the cancer space.
Kwara is also trying to do something. So a number of states are trying to do, but I think it's high time the governors continue now to take a lead.
Right.
This should not be left only to wife of governors.
One might say that the wives should be able to get the governors to do that, but that's a different conversation.
Yeah.
Okay, so what barriers are you seeing? So from the advocacy effort, generally speaking, what are those things that is, like on this program we've talked to an individual that's sourced funds from private sector, used that to get like 11 girls, he's a core member, got 11 girls vaccinated for, they took HPV vaccines. We talked to a member of the government's planning committee for HPV vaccine, rollout. Mm-hmm. So, generally speaking, so far, what are those barriers you've seen, and how can we get over them?
I will tell you two barriers. One is government. Why is government a core barrier to it? Is that the government have not been able to lead. And this is being honest. COVID-19, government led. And you saw how everyone followed.
And it's still leading.
And it's still leading. You saw how everyone followed. So what the CSO Coalition Against Cervical Cancer is asking is that government should use the existing COVID-19 infrastructure and strategy to push for HPV vaccine. If we use it, because it's already existing, the money, the things, the vaccines that things that were purchased are already there. Even the staff, the manpower that already are there. Just use it to now rule.
Okay. So what's the other barrier?
The next barrier that I think it's also about, in terms of volume. Nigeria population is so much.
But the same population will get other vaccines. So why is it that of a barrier for HPV? Is it that it's so expensive?
It's a barrier because it's so expensive. Not everyone can afford a HPV vaccine. And the vaccine that Nigeria needs will probably be the vaccine that almost 5 countries or 10 countries in Europe will require. And those countries produce their own vaccine.
Do you think local vaccine production in Nigeria,
if we can do
on the medium to long term, would be a very good solution?
Absolutely. I think it would be, because the return on investment would definitely be huge on protecting all these kind of infectious diseases that are preventable.
Is that part of your advocacy points as you engage with top level government policymakers? It
is our advocacy point, but not to engage with government on that regard, because the government have started doing something, but it is not showing progress. So the main top thing we are thinking is to get like top business people. Health is business.
But they will tell you that the enabling environment hasn't quite been created.
Well, if they actually see this as business, the money that we spend getting this vaccine from other countries at a higher cost, we can also use that same to actually make this happen in our own.
Thank you very much, Mr. Ransi Chidebe, founder Project Pink Blue and co-chair CSO Coalition Against Cervical Cancer.
Thank you very much for having me.
Okay, that's the much we can take on the program today. We'll be trying to just x-ray what many persons have been able to do from individual level to those in government committees and the civil society. We really wanted to have a voice of a government official, but like I mentioned at the beginning, we wrote a letter to the Office of the Executive Director of National Primary Healthcare Development Agency several weeks before the program, but didn't quite get a response. So we hope that they will be able to make out time to also be on the program to talk to Nigerians so that we get to know more on what they're doing as government and how Nigerians could be of more support. But I'm really excited that many persons are already taking action to solve this problem. It's my hope, if what I heard is true, that the fourth quarter of this year, 2021, that the government might roll out these vaccines. I pray it happens, or much sooner than we expect. So thanks for being part of this. We'll keep along this line of telling you solution stories and meet many other stories that seeks to enlighten you on health issues. Please stay with us, same station, same time next week. My name is Dr. Laz Eze. Bye for now.